Hello there. My name is Dr. Brown Hilda Santo. I'm an internal medicine physician, pulmonologist, and critical care physician. My talk today is on cholera, and I'm giving this talk because of the outbreak that is currently happening in the southwest region of Cameroon. And I hope you'll share this as it may help someone. So it will be a two-part series. And this part will be about the manifestations and the treatment for cholera, and the second part will be mainly I'm talking about prevention and how to prepare safe water. So, what is cholera to start off with? This is an acute secretory diarrheal illness that is caused by a toxin producing strain of a bacteria called Vibrio cholera. And this can be so severe that it can cause dehydration and even death. The mortality can be very high, as high as more than 10%, and sometimes 50 to 7% in some situations, if not adequately handled and urgently. The incubation period, meaning that between the time you get infected and the time you start having symptoms, may be anywhere from 12 hours to up to 5 days. And when you have the illness, it can last for even up to 6 days. So, what are some of the signs and symptoms or clinical manifestations? The patient will have diarrhea, which can be severe to the point where they're losing up to 1 liter per hour. And sometimes the color of the diarrhea may be milky in color, what they call rice water diarrhea. The patient will have dry mouth. They could develop sunken eyes. They could have decreased skin turgor. If you pull the skin, you can actually see tenting, or they could even have wrinkled skin. Sometimes they could have muscle cramps from losing a lot of potassium and calcium. With diarrhea, these patients lose a lot of electrolytes as well. Children can develop hypoglycemia, low glucose levels, and sometimes decreased urine output can be part of the manifestation. Now, how do we treat this when you have this diarrhea? You need fluid resuscitation. You need to drink fluid, but it has to be supplemented with electrolytes. If you have the opportunity to have oral rehydration salts, you can actually use one of the salts and dissolve it in 1 liter of water. If you don't have the opportunity to have one, you can actually make your own at home by taking a 6 teaspoons of sugar and half teaspoon of salt and mixing it in 1 liter of safe water. And we'll talk about safe water in our next series. And you can now you can now start using this. How do you decide what quantity to give the patient? This will depend on the symptoms. If the patient is having diarrhea but not having any of those symptoms that I mentioned, they can keep drinking fluid up to 2 liters a day. If, on the other hand, they're having those symptoms and able to drink, you can then give them fluid, resuscitate them, and sometimes even up to 2 to 4 liters over 3 to 4 hours. So they'll drink continuously as they keep having the diarrhea. If they are symptomatic to the point where they have altered mental status, like they're obtunded, they are weak, they are confused, they're irritable, they are restless, or if they are not able to drink, then you take them to the hospital. In this situation, they will need IV resuscitation with drips, and the appropriate fluid, which can go from normal saline to lactated ringers to the appropriate saline resuscitation that the doctors will feel necessary for the patient will be given. Now, with children can sometimes be a challenge. You can give them 1 teaspoon every 1 to 2 minutes, depending on how they tolerate. And if they vomit, just wait and then give them again. Now, children also will tend to have deficiency in zinc. So in children less than 6 months, it is advisable to give them 10 milligrams of zinc daily for about 2 weeks. And between 6 months and 5 years old, 20 milligrams daily of zinc for about 2 weeks. In some situations, antibiotics may be needed. I'm not going to call any antibiotics any names because I don't want anybody to misuse them. If you're sick enough that antibiotics are needed, then you have to have your doctor or go to the hospital for that to be prescribed. But the important thing is to keep yourself hydrated and with salt or with electrolyte repleted fluids. Now, some people may have the opportunity to to buy some ready-made fluid that already have electrolytes, that's fine also. So the what I want you to take away from this video is that know when recognize some of the clinical manifestations and know when to go to the hospital. Replete yourself with adequate fluid so that you don't get sick enough to be in danger, and then go to the hospital. On my part 2, I'm going to talk about prevention and how to prepare safe fluid. I hope this will help you. Thank you for listening. Knowledge is power.